Now, one of the things that we did when we first entered into these communities was to do an assessment of baseline chronic disease risk factors. And these are the ones that are relevant to overweight and obesity. And basically what you can see in the middle slide here is we found that 37% of the people in the communities were overweight, and an additional 21% were obese. So we are definitely talking about over half of the population being at an unhealthy weight. Only 40% of the population were considered not overweight. So we definitely had a way to go. And this was very much associated with some of the other risk factors. For example, here's representing our diet. We've got the fruit and vegetable intake. And when we assessed the fruit and vegetable intake according to Canada's Food Guide, which recommends at least 7 servings of fruit and vegetables a day, 82% of the population consumed less than what was recommended. So we have a very low fruit and vegetable intake in this province. Then in terms of the physical activity, when people were asked, again, this is self-reported data, but it's an idea of what people think they're doing at least, we only found about 32% considered themselves inactive, but only 38% considered themselves quite active. The majority of people saw themselves in a more of a moderate category. So we do have some work to do in terms of chronic disease risk factors. Now, this is a model of capacity building in health promotion that we developed from the Healthy Alberta Communities Project. This will be very shortly up on the Public Health Agency of Canada's Best Practice portal. It has been accepted as a version of best practices. And basically what this model does, and you can go to our website, www.healthyalbertacommunities.com, and what this model does is it goes through the process that we identified that these communities worked. They went through a process of networking, of partnering, of prioritizing using our Angelo framework, of planning and implementing projects, and then working on supporting and sustaining them. And if you actually go in and click on each of these stages in the model, you'll see there are resources in the model that can help a community to actually adopt this approach. So let's talk a little bit about some of the interventions that were developed in the Healthy Alberta Communities Project. St. Paul is a rural area in northeastern Alberta, and the population is only about 5,000. And one of the priorities that came up through our Angelo framework workshop was the importance of promoting unstructured play among children and youth. That most of the activities that children and youth were getting involved in, those that were active, they had to be driven by their parents to the soccer game or the hockey game or whatever it may be. So in order to promote this more unstructured play, the way that, perhaps I would have played when I was young, they had a do more, watch less challenge, and the idea was to get off the couch and go, and you can see the picture of the little coach potatoes there. But it worked very well through the community health services, and we had a resource kit of some of the things that you could do when you actually did get off the couch. And then one of the areas was trying to ensure that facilities were open and available for members of the community. Schools are often, for example, locked up after school, and yet they have great facilities. They have gyms and all of that sort of thing. So we worked with the schools and with the municipality to try to ensure that there was access to those facilities after hours. And then in the summer, we hired leaders to work on the playground so that kids could just play freely but have some supervision when they were around. Norwood in North Central Edmonton was one of our Healthy Alberta communities, and this is actually a disadvantaged, quite transient inner-city community in Edmonton. So it would be sort of a high-risk community, high poverty rates, that kind of thing. And so you would not be surprised that one of the priorities that they identified was to support food security in their community. The problem with promoting enhancing food security, however, is that very often the model that's used is a charitable model. The idea that, if you provide food at the food bank depot and that kind of thing, that people will have opportunity and access to that food. Well, first of all, the charitable model is really it's not a particularly sustainable model in that it depends on the donations of people, but also the idea of charity for one of life's most basic necessities, food, can be somewhat stigmatizing for people who have to ask for it that way. So we wanted to do something different, and the idea that the community came up with was an urban social enterprise project. And the idea was connecting local farmers to the members of the community and bringing local produce in and selling a box of local produce in the community for a reasonable price. We actually were able to sell these boxes of local produce at regular price to a wide variety of people throughout the city, and then we made sure that there were a number of boxes available at a lower cost, so not a charitable cost, but a lower cost for people who didn't have the means to purchase the whole product. So it helped to connect the local food producers and to enhance food security, and the foods that were provided were all fresh fruits and vegetables. This project is sustainable, and it is working on its own after the initial pilot project that happened in 2009. Now, in terms of how the impact of the Healthy Alberta Communities Project was, we do have some initial data. We're still going through a fair amount of data analysis to find out exactly what happened, but we do know that before and after comparisons of body mass index as a measure of overweight and obesity, we did our initial assessment in 2006, that's the dark blue bar, and we did our post-assessment in 2009, so 3 years later, and that's the lighter blue bar. And what we did find is that overweight and obesity both dropped slightly. I'm unable to tell you whether or not that's statistically significant yet because we haven't been able to do all of the analysis, but we're at least seeing a move in the right direction. And this seems to be coming at a time where in many jurisdictions obesity rates and overweight rates are rising. So we see this as a promising trend at least.